Our work is part of the 100,000 Genomes project from Genomics England, and we have 488 CLL patients that we've sequenced with whole genome sequencing. So we know that CLL is an extremely heterogeneous disease, diagnostically, genetically. And there are many markers that we know have an effect on patient prognosis. The idea behind what we're trying to do is first to use WGS techniques to identify the existing markers that we know that can be used in the clinic in CLL. And the reason why we want to do this with WGS is because at the moment in the clinic you have TP53 mutation, you have deletion 17p, and you have IGHV mutation status. And all of those are looked at with separate techniques. And they're all extremely important for prognosis, but if you want that information, you have to do FISH, you have to do karyotyping array, you have to do microarray, you have to do Sanger sequencing, and that's a lot of techniques all at once. So with WGS, the idea would be that you could replace those with a single test. On top of that, so far there are a little over 250 existing whole genome sequences for CLL. So now that we can identify existing markers, can we find new markers? And WGS obviously allows you to look at the 98% of the genome that isn't protein coding, and is the potential for marker discovery here as well. So with our whole genomes, we want to do both those. We want to do existing markers and new marker discovery. So far we've found mutations in some of the key driver genes in CLL across the whole cohort. We've seen SF3B1 in over 17% of patients. We've seen Notch1 mutated in 15%. We've seen TP53 in over 12%. So we've also combined multiple pieces of software together that allow us to identify significantly mutated genes. And from here we've identified two possible genes of interest that are worth following up on, WDR74 and another one.